About a year or two after cataract surgery, something strange can happen. At first, everything was wonderful, colors looked brighter, night driving felt easier, menus were clearer. You may have even told friends that cataract surgery gave you your life back. And then, little by little, your vision starts to seem cloudy again. Headlights begin to glow more than they used to. Reading feels a little harder. Bright morning light looks hazy instead of crisp, and almost everyone has the same worried thought: is my cataract coming back? The good news is no. A cataract does not grow back after it has been removed. But there is another very common reason vision can become blurry again after cataract surgery. And if nobody explained this to you before, you are not alone. Many patients are never clearly told about it until it starts happening. Today I want to explain, in plain English, what may be going on inside your eye, how doctors usually fix it, when you should call right away, and why this problem is often much easier to treat than people expect. I'm Dr. Anna, and on this channel I help older adults understand their health in a calm, practical, and easy-to-follow way. If that sounds helpful, subscribe and join me for more videos made especially for seniors and their families. And before we go any further, tell me in the comments how long it has been since your cataract surgery. A few months? 1 year? 3 years? I always like to see the patterns people are noticing. Now, before we talk about the common cause of blurry vision after cataract surgery, I need to make one thing very clear. If you suddenly lose vision in one eye, if you see a dark curtain or shadow moving across your vision, if you notice a sudden shower of new floaters or flashing lights, or if you have severe eye pain, that is not something to sit on. That needs urgent medical attention. Call your eye doctor right away. What I'm talking about in this video is usually different. It tends to come on slowly. It is usually painless. It often feels more like fog, glare, haze, or loss of sharpness than a sudden emergency. So what is it? The most common cause is something called posterior capsular opacification, or PCO. That name sounds technical, but the idea is actually simple. During cataract surgery, your surgeon removes your natural cloudy lens and replaces it with a clear artificial lens. But that artificial lens needs support. So it sits inside the thin natural capsule that used to hold your original lens in place. You can think of it like this. The cloudy contents are removed, but the thin clear wrapper that held them is left behind to support the new lens. Over time, that thin capsule can become cloudy. Not the new lens itself, not a new cataract, the capsule behind the lens. When that capsule loses its clarity, light does not pass through as cleanly as it should. Instead, the light scatters. And when light scatters, your vision starts to feel dimmer, blurrier, hazier, and more bothersome, especially around lights at night. That is why so many people say, it feels exactly like my cataract is coming back. It feels that way, but that is not what is happening. Now let's talk about why this happens. Even after a very successful cataract surgery, tiny lens cells can remain in the capsule. That is normal. Over the months and years after surgery, some of those cells can slowly grow and spread across the back part of the capsule. As they build up, the capsule becomes less transparent. You did not cause this. It is not because you bent over the wrong way. It is not because you read too much. It is not because you missed 1 day of drops a year ago. It is not because you slept on one side. And it is not proof that your surgery failed. It is simply one of the most common long-term changes that can happen after cataract surgery. In fact, it is common enough that many eye doctors see it every single week. And there are a few myths I want to clear up right now. First, many people assume the cataract has returned. It has not. A true cataract forms in your natural lens, and that lens has already been removed. Second, many people think they will need another cataract surgery. Usually they do not. The treatment for PCO is not another full surgery. Third, some people hope it might clear up by itself if they just wait long enough. In most cases, it does not. If the capsule is becoming cloudier, waiting usually means the symptoms continue or gradually worsen. And fourth, people often worry that if they treat it once, it will just keep coming back again and again. In most cases, that is not what happens. Once the cloudy capsule is opened with the laser treatment, the problem is generally considered permanently resolved in that eye. Now let me give you a simple at-home clue that may help you notice whether one eye is significantly worse than the other. Pick something across the room with clear contrast. A wall clock, a book title, words on a television screen, or a calendar can work. Cover one eye and look carefully. Then switch and cover the other eye. Ask yourself, does one eye look noticeably foggier, dimmer, or less sharp than the other? This is not a diagnosis, but it can help you realize that the problem may be coming more from one eye than the other. If you had cataract surgery in that eye and the blur has gradually returned, that is a very good reason to schedule an eye exam. And when you call, it can help to use the right words. You can say, "My vision has become cloudy again after cataract surgery, and I'd like to be checked for posterior capsule opacification." That tells the office exactly what concern you have. So how is it treated? The standard treatment is called a YAG laser capsulotomy. Please don't let the word laser scare you. For most people, this is quick, straightforward, and done right in the office. Typically, you come in, your eye is dilated with drops, and sometimes a numbing drop is used too. Then you sit at a machine that may look similar to the one used during a regular eye exam. The doctor focuses the laser on the cloudy capsule behind the artificial lens and creates a small opening in it. That opening lets light pass through clearly again. There is no large incision, no stitches, no operating room in the usual sense, and the laser part itself often takes only a few minutes. Many patients say it is easier than they expected. You may notice some improvement the same day, and many people notice clearer vision within about 24 hours, sometimes a little longer depending on the eye and any other conditions you may have. Some doctors prescribe anti-inflammatory drops for a short time afterward. You may also have your eye pressure checked after the procedure, because in some people the pressure can rise temporarily. That temporary pressure increase is one reason follow-up matters, even after a quick procedure. Now, because I always want to be honest with you, I also want to mention the risks. Laser capsulotomy is widely used and generally considered safe, but no eye procedure is completely risk-free. A temporary rise in eye pressure can happen. Some people may see floaters for a short time afterward. Swelling can occur in some cases. And there is also a small risk of retinal detachment, which is uncommon but important to know about. That is why your eye doctor should know if you are very nearsighted, if you have had retinal problems before, or if you have a personal or family history of retinal detachment. There are also times when a doctor may choose not to do the laser right away. For example, if there is active inflammation in the eye or swelling in the macula, those issues may need to be treated first. So if your doctor says, "Let's wait," it does not always mean they disagree with the diagnosis. It may simply mean they want the eye calmer and safer before moving forward. Let me give you an example. Imagine a 72-year-old woman named Margaret. She had cataract surgery and loved the result. For more than a year, her sight was brighter and sharper than it had been in decades. Then, slowly, she began noticing that one eye was not as clear as the other. The lamp across the room had a glow around it. The words on the television were not as crisp. Night driving felt slightly more annoying. She thought maybe she needed stronger glasses. She also worried the cataract had somehow returned. When she finally went in, the diagnosis was posterior capsule opacification. The laser procedure was done in the office. It took only a few minutes, and within the next day or two, the haze she had been living with was dramatically better. What had been quietly bothering her for months turned out to have a very clear explanation and a very standard fix. That story is common. And unfortunately, there are a few habits that delay diagnosis. One is assuming, "I'm getting older, so maybe this is just normal." Sometimes aging does affect vision, yes. But cloudy vision returning after cataract surgery should not be brushed off as something you simply have to accept. Another delay is waiting for your next routine yearly visit, even though your vision has clearly changed. If the change is new and noticeable, call sooner. A third delay is thinking new glasses will solve everything. Glasses can help with many vision issues, but if the problem is a cloudy capsule scattering light, glasses often will not fix the real cause. So here is a simple action plan. First, pay attention to the pattern. Has your vision slowly become more hazy after initially improving from cataract surgery? Second, compare each eye one at a time and notice whether one seems worse. Third, call your ophthalmologist or eye surgeon and ask for an evaluation, especially if the blur, glare, or halos are affecting reading, driving, or daily life. Fourth, ask direct questions at the appointment. Is this posterior capsule opacification? Am I a good candidate for YAG laser capsulotomy? Are there any reasons to delay treatment in my case? And fifth, if the doctor recommends the laser, don't assume it means starting all over again. For most people, this is a brief office procedure with little downtime. Now let's recap the most important point. If your vision gets cloudy again months or years after cataract surgery, that does not automatically mean the cataract came back. In many cases, it is posterior capsule opacification, a very common clouding of the capsule that supports your artificial lens. It can cause blurry vision, glare, halos, and reduced sharpness. It often comes on gradually. It is usually treatable, and the usual fix is a quick in-office YAG laser procedure. But remember this too: sudden vision loss, flashes, a curtain over the vision, many new floaters, or severe pain are not symptoms to ignore. Those need urgent medical attention. If this video helped make sense of what may be happening, share it with someone who has had cataract surgery. They may be worrying in silence and not realize there could be a simple explanation. I'm Dr. Anna. Subscribe for more clear, senior-friendly health videos, and if you'd like, leave a comment telling me how long it has been since your cataract surgery and whether your doctor ever warned you this could happen.